Releasing the low back has been the goal of this entire basic routine sequence. After doing the required prep work to release all the supporting anatomy for the low back, the time has come now to dig into the spinal erectors. In addition to the spinal erectors, the quadratus lumborum will also receive treatment with this technique, thus completing a full low back release. It is possible but not advised to use the AcuLever on the spinal erectors if you are feeling nerve radiation in the piriformis, gluteus, hamstring regions, or, in some cases, the IT band region. For an injured person, there is a degree of difficulty in positioning the body to execute the two spinal erector techniques. The best strategy in this case would be to continue to release the psoas and quadriceps muscles until the radiation clears. Since there are two spinal erector techniques to be completed here, there will be two positions for the AcuLever. The first position is 0 degrees on the horizon, with the second at 35 degrees. The AcuLever is set here to treat the right spinal erectors in the second technique. Note that it is the right fin blade making contact with the body. It is optional to use the patented lever plate for this technique, as the top plate with the fin blades is sufficient to open the spinal erectors dramatically on its own. The first spinal erectors technique uses both blades equally while outlining the spinal cord. The technique is to lean straight back over the tool, the blades inserted equally into the left and right sides of the spine. Position the AcuLever on a table or the floor at 0 degrees on the horizon, perpendicular to your body. Lean straight back with the tool firmly secured in your hands to a depth that is deep for you. From this side perspective, we can see a correct positioning and lean back to being supported on both forearms equally. Execute a tool-assisted stretch in any of the three positions. Simply lean back all the way and stretch your arms over your head. You can roll your extended legs side to side and then continue with bent knees. Using the patented lever plate while executing this rolling movement will increase the therapeutic action of the cross-fiber friction. It is best to start with a slow side-to-side rolling movement when first treating the spinal erectors. You can always increase your speed as you become more comfortable. To continue to the next position, simply lift your hips and move to the second spinal erector site. Repeat the entire routine over again of rolling the legs side to side in both the extended and bent knee positions. If you are fortunate enough to have a stretching partner, sit up and move the AcuLever out of the way. Your partner will bring your feet to their torso and then lean in to push both knees gently but fully towards your head. This concludes the first spinal erectors technique. The second spinal erectors technique uses one blade to cut deeply on one side of the spine. The technique here calls for leaning back on the same side that is being cut by the AcuLever. Position the AcuLever on a table or the floor at 35 degrees on the horizon. Lean back and somewhat to the side that you are cutting to a depth that is deep for you. Note that the tool is firmly secured in your hands and that one hand is further back. This allows you to lean into the tool with more power and control. To change positions, simply lift yourself forward and then lean back again. To execute a tool-assisted stretch in any of the three positions, simply lean back all the way. If you are fortunate enough to have a stretching partner, the partner stretch here is the same as for the first spinal erectors technique.